Once a woman gets pregnant, the goal of standard obstetrics care is that her pregnancy journey will be exciting, irrespective of complications in pregnancy, challenges, or symptoms that she may have. But beyond that, irrespective of the route of delivery, we want her and her baby or babies to be alive and well. She may deliver naturally, or there may be indications for a cesarean section delivery for her. So stick with me to the end of this video as I list 22 reasons or indications why we will deliver a woman through cesarean section. In no particular order, number one is what I call cephalopelvic disproportion. It means that the head of the baby is bigger than the passage or than the birth canal. Usually we want the baby to come with the head. That is number one. If the head of the baby or if the baby is bigger than the pelvis, the birth canal of the mother, then it is an indication for a cesarean section. Number two is fetal distress. By fetal distress, we mean that this woman is already in labor, but the baby is no longer tolerating that process of natural labor and childbirth. Number three is breech presentation, or with a broader use of term, malpresentation. The baby should come with the head down. But if the baby is not coming with the head down, if the baby is lying transverse, if the baby is lying oblique as against the baby coming with the head down and the bum up in a longitudinal line, especially in first-time mothers, then it is an indication for a cesarean section. Number four is what we call placenta previa. There is the right or normal or usual location of the placenta in the womb during pregnancy. If the placenta is not where it should be situated, if the placenta is covering the cervix, then it is an indication for a cesarean section. Number five is placenta abruptio. It means that the placenta is separating from the womb ahead of time. The placenta normally should not separate from the womb before the baby is delivered. After natural delivery or after a CS is when the placenta should separate. If the placenta separates before the baby is born, then it is an indication for a cesarean section. Number six is multiple gestation. Multiple gestation, by which I mean you are carrying a set of twins or a set of triplets with abnormal presentation. If the first baby is coming breech or transverse, or if both babies are coming breech or transverse or oblique lie, then it is an indication for a cesarean section. Number seven, when we have obstructed labor, maybe from what we call poor progress or cervical dystocia, when we say that the cervix is not dilating at the rate it should dilate. Or you will hear women say, I had a cesarean section because they said I dilated to 6 centimeters, 7 centimeters, and I was no longer dilating. Poor progress, that is number seven. Number eight is uterine rupture. Uterine rupture means the tearing of the uterus, the tearing apart of the womb. This is more common in women that have had a previous cesarean section, but we have seen it happen also severally in first-time mothers, in first-time pregnancies, in first-time natural process of labor. So uterine rupture is another indication for a cesarean section. In fact, an indication for an emergency cesarean section. Number nine is cord prolapse. Cord prolapse means that the cord, the umbilical cord, seeps through the cervix ahead of the coming of the baby. Number 10, failed induction of labor. We have women that have passed 40 weeks, well over 40 weeks, but they are not going into spontaneous labor and they've not had a cesarean section before. What we want to do is to medically induce labor in them. By the time we try to induce labor 1, 2, or maximum 3 times, but they are not going into labor, we call it a failed induction of labor. Then they have to be delivered via cesarean section. Number 11 is a failed VBAC. VBAC is attempting natural delivery after a previous cesarean section. We would want this woman to go into labor spontaneously when we see that all of the factors that will favor natural delivery is there. If she does not go into spontaneous labor after a previous cesarean section, because we don't want to induce, then this is an indication for a cesarean section. Number 12, when we have maternal infections, severe maternal infections like HIV with high viral load, we want to reduce the risk of a transmission of HIV from the mother to the child. So when the woman has a high viral load in HIV infection, for example, it is an indication for cesarean section. Or Other infections like an active genital herpes or active genital warts, we don't want a baby, to be infected because the mother is in the active phase of the infection with genital herpes or genital warts. Then it is an indication for a cesarean section. Number 13, fetal macrosomia. It means that this baby is bigger than normal. Once we have a baby that is 4 kg or bigger than 4 kg estimated fetal weight, then it is an indication for a cesarean section. Number 14, when you have a woman that has been delivered through cesarean section twice, every other pregnancy must be delivered via a cesarean section. So 2 previous cesarean section is an indication for subsequent pregnancies to be delivered via cesarean sections. Number 15, maternal extortion. This woman went into labor herself, or she was induced and she went into labor, but she's becoming increasingly tired, increasingly weak. She's losing energy, she's losing strength. Then this is an indication for a cesarean section delivery. Number 16, maternal request. The woman comes in and says, I want to deliver through a cesarean section. We will not say no. So maternal request is an indication for delivery through a cesarean section. Number 17, when we see a woman with poor or bad obstetric history. Poor or bad obstetric history means this woman has been getting pregnant, but at the end of the day, there is no baby in quotes to show for it. Ectopic pregnancy, recurrent miscarriages, stillbirth, neonatal deaths, and all of those. Multiple pregnancies with no baby in quotes to show for it. Once the woman gets pregnant during antenatal, we start to counsel and prepare her for an elective cesarean section. The number 18 indication is prolonged period of infertility. Prolonged period of infertility. At the end of the day, when the woman gets pregnant, maybe by natural means or by assisted reproductive techniques, you will want to deliver him or her via CS. Number 19, babies that were conceived through assisted reproductive technique, IVF babies, we want to usually deliver them via cesarean section. Number 20, complications in pregnancy like severe preeclampsia or eclampsia. Severe preeclampsia is poorly controlled elevated blood pressure in the woman. Eclampsia is poorly controlled elevated blood pressure in the woman with the presence of convulsing. The woman has to be delivered immediately through the fastest route, which is usually through a cesarean section. Number 21, when there is a desire for a BTL, a desire for a bilateral tubal ligation, tying up of her tubes, and she feels, yes, this thing can be done after I deliver through the natural means, but why don't I just go in for a CS so that my tubes can be tied? Immediately the CS is completed. A desire for a BTL. She and her husband have agreed that they have completed their family size. What they now want is to tie off, clip off, seal off the tubes. A BTL. This could also be an indication for a cesarean section. The number 22 reason is a previous history of myomectomy, especially if the myomectomy is extensive or the internal lining that we call the endometrium of the uterus is breached. It is the gynecologist who performs this surgery that will be able to tell you the extent of the myomectomy procedure that he performed on you. But once it is extensive, or if the endometrial layer is breached, then it is an indication for deliveries through cesarean section for every woman that is pregnant and has gone through a myomectomy. But remember, like I said, at the end of the day, the goal of standard obstetrics care is that mother and child are alive and well at the end of pregnancy, irrespective of the route of delivery.